Welcome to another episode of Med Madness, where we delve into crucial topics for medical students preparing for their USMLE exams. Today we are focusing on intra-amniotic infection, also known as chorioamnionitis, a significant condition that every aspiring physician must understand. This topic is particularly relevant due to its impact on both maternal and neonatal health. Throughout this episode, we'll explore what chorioamnionitis is, its causes and risk factors, symptoms, diagnosis, management, and treatment. We'll also walk through a real-life case study to solidify your understanding. Next, let's discuss what this condition is. Intra-amniotic infection, or chorioamnionitis, is an infection of the amniotic fluid, membranes, placenta, uterine decidua, and umbilical cord. This condition usually occurs due to the migration of vaginal or enteric flora through the cervix into the uterine cavity. The infection is often polymicrobial, involving a variety of bacteria. Common causes and risk factors include prolonged rupture of membranes, preterm pre-labor rupture of membranes, prolonged labor, use of internal fetal or uterine monitoring devices, repetitive vaginal examinations, and the presence of genital tract pathogens. Understanding these factors is vital for preventing and managing this condition effectively. Next, let's talk about symptoms and clinical presentation. Patients with chorioamnionitis typically present with a combination of maternal and fetal symptoms. Maternal signs include fever, nausea, vomiting, uterine fundal tenderness, maternal tachycardia, and leukocytosis. On the fetal side, one might observe fetal tachycardia, defined as a sustained fetal baseline heart rate over 160 beats per minute for at least 10 minutes. Additionally, the amniotic fluid may appear purulent. These clinical features are key indicators that prompt further investigation and management. Moving on, let's discuss diagnosis. Diagnosing intra-amniotic infection involves a combination of clinical signs and laboratory tests. The presence of maternal fever is a critical indicator, accompanied by at least one of the following: fetal tachycardia, maternal leukocytosis, or purulent amniotic fluid. Diagnostic methods include clinical examination, blood tests for maternal white blood cell count, and amniotic fluid analysis. Screening and monitoring tools like fetal heart rate tracing can reveal signs of fetal tachycardia, further supporting the diagnosis. Next, let's cover management and treatment. Effective management of chorioamnionitis requires prompt administration of broad-spectrum antibiotics such as ampicillin, gentamicin, and clindamycin. Immediate delivery, often via augmentation of labor, is crucial to remove the source of infection and reduce risks to both mother and baby. Supportive care includes antipyretics like acetaminophen to manage maternal fever and intravenous fluids to maintain hydration, recognizing and addressing complications such as postpartum hemorrhage and endometritis in mothers, and preterm birth, pneumonia, and encephalopathy in neonates is essential for comprehensive care. Next, let's consider a case study to illustrate the clinical scenario of chorioamnionitis. A 28-year-old pregnant woman at 34 weeks gestation presented with a history of prolonged rupture of membranes exceeding 18 hours. She experienced fever, nausea, and uterine tenderness. Fetal heart rate monitoring showed a baseline heart rate of 165 beats per minute. Laboratory tests revealed maternal leukocytosis. Given these findings, a diagnosis of intra-amniotic infection was made. The patient was promptly started on broad-spectrum antibiotics, and labor was induced to expedite delivery. Both maternal and neonatal outcomes were favorable, highlighting the importance of early recognition and intervention. For more lifelike voices, higher character limits, and dubbing content in other languages, head to https://11labs.io?UTM_source=11labs_GPT